Go.
Hi, I'm Katie. I'll be your provider today. I'm just going to wash my hands first. We're just going to do an assessment. We're going to start with cardiac. So I'm actually going to have you take your shirt off and lay back for me. And we're going to have you at 30 degrees. So we have these pillows behind you. Okay, perfect. First, I'm just looking at your pericardium and just noting any masses or heaves or just making sure everything's symmetrical. So I am just gonna palpate here. Let me know if you have any tenderness. Any tenderness?
No.
Okay, and we'll just go ahead and we're gonna listen for your carotid arteries on each side. Okay, take a deep breath in. Okay, and you can let it out. And deep breath in. And let it out. Okay, I'm not hearing any worries. And then we're just gonna palpate. And the other side. Okay, +2 bilaterally. So then I'm just gonna feel for your PMI, which is on the left side. And it is at the midclavicular line, 5th intercostal space where the mitral valve is. So I'm just feeling for that pulse. Perfect. So now we're just gonna listen, starting with the diaphragm. I'm gonna listen to your aortic valve on the right sternal border, 2nd intercostal space. Pulmonic valve, left sternal border, 2nd intercostal space. Then we're gonna move down to Erb's point, which is 3rd intercostal space, left sternal border. Then going to the 4th intercostal space, left sternal border for the tricuspid valve. And then 5th intercostal space. And we're gonna go left sternal border, midclavicular line for mitral. Okay, now I'm just gonna move my stethoscope to the bell and we're gonna listen for the, again for the tricuspid and mitral in that 4th intercostal space. And then 5th intercostal space, left sternal border. Perfect. And I'm actually gonna have you turn on your left side. I'm gonna listen to your mitral valve because this just brings the heart closer to the chest wall. So I'm gonna have you just take normal breaths while we listen. Okay, and breathe in, breathe out. I'm not hearing any murmurs. And I'm just gonna have you sit up for me for just a second on the edge of the table because we're gonna do an aortic valve test. And I'm actually gonna have you lean forward. And we're gonna be listening here. Okay, so take a deep breath in for me and out, and not hearing any murmurs. Okay, we're gonna move on to the abdomen. So I'm gonna actually have you lay flat. We'll have your knees bent and your hands by your side. First, I'm just gonna inspect, not symmetrical, not seeing any bruising or masses. And then we're just gonna listen for your renal and iliac arteries using the bell of the stethoscope. So this is the right renal artery in the right upper quadrant, left renal artery in left upper quadrant, right iliac artery in the right lower quadrant, and left iliac artery in the left lower quadrant. Also listening for the aorta. Okay, I'm not hearing any worries. Now we're just gonna palpate in all quadrants and let me know if you have any pain or tenderness. Okay. Any pain?
No.
Okay, it's soft, non-tender. Now we're just gonna percuss your liver. So we're gonna go until we're gonna hear tympani until we hear dullness. Just about there. So right about there, under her ribs is where her liver is. And now we're gonna try to find around the midclavicular line, 6th intercostal space, we're percuss for the spleen. However, You can't really hear anything unless you have an enlarged spleen, so that is normal. Now, I'm gonna put my hand behind you. We're gonna palpate the liver. So I'm actually gonna have you take a deep breath in and exhale. And her liver is right about there in a normal spot. Does not seem enlarged. And we're gonna try the same thing and see if we can feel the spleen. I'm just gonna put my hand here. Now take a deep breath in and out. Okay, here, feel the spleen, which is normal. Only can feel it in about 5% of people. We're gonna also do a hand behind your back, and we're gonna feel for the right kidney and just breathe in and out. Okay, same thing on the other side. Trying to feel your kidneys, breathe in and out. Okay, perfect. And we're gonna feel for your aorta, which is above the umbilicus a little to the left. And we can feel right there, so then we're just gonna spread my fingers out and try to measure how big it is, and about right there, so yours is about 2 centimeters, which is normal. Okay, we're gonna move on. I'm gonna feel all your pulses, so I'm gonna feel radials, and then moving on, I'm gonna have you lay your legs out. We'll feel your pedals and tibials. So everything's about a +2, easy to palpate. This is the tibial pulses. I'm gonna press down and just check for edema. No edema. We're gonna feel your femoral pulses, and we're gonna feel your radial pulses while we do it to make sure it's the same bilaterally, which it is. Same thing, just gonna reach under your shorts on the left side. Perfect, everything's about a +2, and I'm also just gonna go under short where I'm just feeling the inguinal lymph nodes. I don't feel any enlarged lymph nodes. Same on this side. Okay, so we're gonna move on to your neuro assessment. So we're actually gonna let you sit up and you can put your shirt back on. I'm gonna have you swing your legs over, sit on the edge of the table. Okay, take your time. So we're gonna check some of your cranial nerves, starting with olfactory. So I'm gonna actually have you close your eyes for me and occlude one nostril and tell me what you smell.
Garlic.
Okay, keep your eyes closed and switch nostrils for me, and I'll tell you what you smell.
Onion.
Okay, we're also gonna check cranial nerves 5, 7, 11, and 12. So keep your eyes closed. I'm gonna put something in your hand for you to put in your mouth and tell me what you taste.
Chocolate.
Chocolate, perfect. Okay. When you're done, we're gonna move on. Keep chewing. Okay, you can actually close your eyes for me, and we're gonna. Okay, take your time. Okay, close your eyes. Well, go ahead and just check sensation. Tell me where I'm feeling.
Forehead. Cheek. Chin.
Perfect. Okay, now open your eyes. Close your eyes real tight. Lift your eyebrows. Puff up your cheeks. Smile. Stick your tongue out. Tongue is midline. We're going to check some of your motor. So go ahead, open your mouth when you can, and then then I'm going to try to not let me press your jaw up. Okay. So open. Perfect. Now push against my hand. Push against my hand. And shrug your shoulders. Okay. I'm going to move on to cerebellar function. So go ahead and we're going to check both sides really quick. Go with the left side. I'm going to have you tap your hand against my foot for this side. Same for this side. Do your foot to your shin. Just kind of brush against that side. Brush against that side. Perfect. So we're going to have you, with your eyes open, stick your arms out like this. Now close your eyes. And we're going to see if we know any pronator drift. We're going to do that for about 20-30 seconds. Okay, looks normal. Now we're gonna do your nose to finger. So touch your nose, okay, and then touch my finger, touch your nose, touch my finger. A couple more times, and there. Okay, now go ahead, close your eyes. We're gonna check your proprioception, and then touch your nose. Perfect. Okay, we are gonna check your sensation now. So I'm gonna show you what sharp feels like. This is sharp. Okay, feel that, and then this is dull. Now I'm gonna have you close your eyes. Tell me where I'm touching you and if it's sharp or dull. Okay.
Arm and sharp. Arm and sharp.
Okay, let me try again.
Dull.
Yep.
Dull and arm. One more time. Sharp and
Okay.
arm.
Keep going.
Sharp and leg. Dull and leg.
Okay. A few more.
Sharp and chest. Sharp and chest.
Couple more.
Sharp and back. More sharp.
Sorry.
Dull and back. Sharp and back.
Okay, one more time.
Dull and back.
And last one.
Sharp and back.
Actually, keep your eyes closed. We are just gonna check your feet. Okay, tell me when you can feel it.
I feel it. Yep. Yep. Mm-hmm.
Same thing other side.
Yep. Yep. Yep.
Okay, and we're gonna check your reflexes. Okay, we are gonna do, so just relax your arm. We're gonna do your biceps. Okay, I'm gonna do this side. So I'm gonna have you relax. Okay, we're gonna check triceps. So, let's see. Have you kind of relax your arm. Okay, same thing on this side. And just relax. One more time. Okay, I'm gonna check your patellar. One more time. Okay, and then check behind your feet. So I'm just gonna have you relax your feet in my hand. Sorry, let me do one more time. Okay, same thing on this side. One more time. Okay, perfect. Now we're just gonna check motor functions. I'm gonna have you stand. Okay, so just kind of walk normally back and forth for me for a second. Okay, now can you walk on your toes? Perfect. Now turning around, can you walk on your heels? Can you then walk in tandem where you do one foot in front of the other? Okay, now jump on, we're gonna have you jump on your feet, your right, your left. And now I'm gonna just check the Romberg test. So I'm gonna have you close your eyes. I'm gonna put my hands here, just making sure you don't drift. Okay, that's everything for our